Body image, insofar as it includes weight and shape, is generally a more intense and complex issue for girls than for boys. I say this with the knowledge that body image is a bigger issue for boys now than it was 10 or 15 years ago. But generally, body image plays a bigger role in girls' self-esteem than it does for boys, because boys are still valued more based on their action and achievement, while girls, in spite of being encouraged to achieve these days, are still valued most for their appearance. Both boys and girls see body image ideals prescribed for them in the social world. Since the late 1960s, the main ideal for girls has been thin or thin and toned. For boys, the dominant ideal is to be muscular. Neither of these ideals includes any significant body fat. This is a particular disadvantage for girls. I don't think it's good for anybody, but it's a particular disadvantage for girls. Because prior to puberty, boys and girls both have the same percentage body fat, about approximately. But at puberty, girls who are developing well, their bodies getting ready for having periods and so on, will have an increase in body fat. At the same time, boys at puberty will naturally lose fat and increase muscle. So while the muscular ideal for boys is consistent with the direction of their normal body development, the thin, toned ideal for girls is directly contrary to their body's natural direction. Thus, girls are socialized to be dissatisfied with their bodies. Our current near phobia about fat has made us intolerant of girls' healthy body development. It's no wonder then that research shows that body image dissatisfaction increases at puberty. So we can, all of us who are beyond puberty at this point, can remember back to puberty and how awkward we felt. So that body dissatisfaction and awkwardness resolves much more quickly for boys. What happens to girls is that it becomes a stable, ongoing characteristic. Weight and shape concerns are linked to depression, to dieting, to eating problems, including eating disorders. So we should be very concerned about how much body dissatisfaction there is. And dieting itself plays a significant role in weight gain and in the development of eating disorders. A research study, so you might be surprised to hear about the weight gain thing, a research study at Harvard University about 10 years ago showed that over a 3-year period, middle school children who dieted regularly gained more weight than children who never dieted. And that's for controlling for the normal amount of weight gain that goes along with growing. And yet dieting continues to be seen as a solution to the weight and shape concerns of young people. Most concerning is that children and teens are in a physical and psychological developmental process, at least up to when they turn 18, that includes the development of the bones and the brain. Height, bone density, and cognitive development can all be compromised when young people don't eat enough. Healthy eating is no doubt a good thing, but there is a reason young people are attracted to high-calorie or dense fast foods. They're growing, and they're growing fast. Their needs are not the same as adults, and they should not be dieting at all. I'm going to say that again. Young people, children, and teens should not be dieting at all. So beyond these general cultural factors, there are some things that we know that contribute to eating problems. They include body-based teasing and bullying, and sexual harassment, as well as sexual or physical violations. They all tend to generate body shame, which makes it even more likely that a young person will resort to dieting or other weight and shape control methods. Early puberty is also a risk factor. We think probably one aspect of that is that because of the unwanted attention, often sexual attention, that occurs and that the child isn't ready for because she's a child. So I'm going to shift away from the cultural into sort of a more micro level now and just talk about one kind of an example of how the cultural factors can interact with more individual kinds of factors to make an eating problem or make dieting seem like a solution to a problem, and how that can become an eating disorder. It's just one kind of story about how that can happen. It's not all of the story by a long shot. It seems fairly clear, though, that a certain kind of temperament or characteristics can make a girl more vulnerable to an eating disorder. Anorexia, for example. So being highly sensitive, detail-oriented, perfectionist, very structured, and with exceptional focus are some. Being very intelligent is another. If you were looking for a heart surgeon, you would do very well to find someone with these characteristics. You don't want someone who's going to, go all creative at the last minute. So not that girls with these characteristics can't be creative either, but when there's a procedure that they will follow it. Or if you wanted to build a bridge or a software program, they would be very helpful too. You want someone who will do the right thing. The same characteristics that help make a 35-year-old great female heart surgeon make a 13-year-old girl more vulnerable to eating disorders. Just more vulnerable than average. It doesn't cause. We're not talking about causes. So let's start a few years earlier. A 10-year-old girl with this temperament is often highly prized by teachers and considered just lovely, no trouble by her parents. She relies on her parents and teachers to tell her what they want and is pleased to give it to them. She does very well because of her attention to detail and her pleasure at getting things right. At puberty, things change. Developmentally, she and her peers become more attuned to one another and less devoted to what their parents want. In this context, there is no easy answer to the question, what is the right thing to do? So she might be overwhelmed by the choices now in front of her. If she wears makeup and tight clothes, she'll fit in with her peers, but attract attention she might not know what to do with, and make her parents nervous. If she smokes cigarettes, drinks, or uses drugs, she'll have an instant social group, but at the same time make herself too nervous to enjoy the effects. This temperament and intelligence create an awareness our girl is not yet emotionally mature enough to handle. In relating to others, she's excruciatingly aware of small changes in their facial expressions, voice tone, and body language. She'll feel overwhelmed and anxious, not knowing what to respond to. Again, she will be looking for a way to simplify things, a clear way of choosing what to do. Dieting and weight loss provide her an immediate and direct way of knowing whether she's done the right thing every day. Eating less and losing weight is good. Eating more and not losing weight is bad. To make this even more seductive, losing weight brings admiration from adults and peers alike. In this context, perfectionism, being detail-oriented and highly structured, ensures that this girl will be able to continue the dieting and weight loss almost indefinitely, taking her beyond admiration and into the territory of disorder. Instead of her own lovely autonomous voice beginning its development at this time, the authoritarian voice of an eating disorder takes over, giving the relentless message to lose weight. So it's a scary picture. There's, again, it's an oversimplified kind of story, but it can give a little bit of a sense of how these things can happen. So what can parents do? On the prevention side, keep the lines of communication open so your child knows that she or he can talk to you. Encourage body acceptance and discourage dieting. If you hear stories from your child or teen of harassment, teasing, or bullying, take them seriously, follow them up. And watch for changes in eating patterns. For instance, weight loss or frequent changes in weight that can be accompanied by inappropriate dress, such as warm clothes in the summer or layered clothing at the beach. A visible change in eating patterns like eating less, separating oneself from the family members at mealtimes, excessive talking at mealtime to detract attention from eating, cooking and baking for others but not eating what she has made or he has made, increased use of the bathroom, especially after meals, change in physical activity patterns, such as insisting on taking the dog for a walk even in bad weather, and complaints of feeling cold and tired continually. So for parents, though, I also want to add a really important message that most parents with kids who suffer from eating disorders experience a tremendous amount of guilt and anxiety. But our message to parents is it's not your fault. We really don't know what causes eating disorders, and there are as many different kinds of families where someone has an eating disorder as there are families where nobody has an eating disorder. So really the point is to move on and to concentrate on getting the child well. And parents play an extremely important and critical role in that process. So I'll stop there.
Thank you.